Being presented with a diagnosis of cancer can be an emotionally devastating experience. Depending upon the severity of the disease, every aspect of one's life can be affected. In this program, we will try to put into perspective the effect cancer can have on one's job or career, given the tremendous advances of the last 10 years in medical therapies, in legal protection, and even in the public's perception of this disease. 4 specialists with different areas of expertise will put into perspective the effect cancer can have on one's job or career. Diane Blum from New York City will offer advice from a social worker's point of view. In the medical profession, you will hear from Dr. George Kanellos, William Rosenberg Professor of Medicine at Harvard Medical School and Chief of Medical Oncology at Dana-Farber Cancer Institute in Boston, and Michelle Goodman, Oncology Nurse Specialist at Rush Presbyterian St. Luke's Medical Center in Chicago. And finally, Michael Spector, an attorney, will discuss relevant legal issues and the Americans with Disabilities Act.
Many people derive a sense of usefulness and purpose from a job well done. For most of us, work offers a sense of identity, of this is who I am. If illness strikes, people may worry, will I be able to function properly on the job? Will I lose my chance for a promotion? Will I be absent a lot? And how will my coworkers react? What will happen to my health insurance? These are all natural, understandable concerns, especially if one is diagnosed as having cancer. For many types of cancers, treatment today is quite different from what it was even 5 years ago, enabling many people to keep working who previously could not. Discuss treatment options with your doctor. You may wish to talk with specialists such as a surgeon or a radiotherapist, and you may also want to get a second opinion. Remember, while you may feel you need prompt attention, a cancer diagnosis is rarely an emergency. Your decisions about where, how, and by whom to be treated are important. Take some time to think everything through and talk with people you trust. Your physician, your oncology nurse, or hospital social worker can refer you to organizations that help people with cancer make informed decisions.
Our understanding of the biology of cancer has improved considerably in the last 5 to 10 years. In the past, patients with colon or breast cancer, for example, might have been treated only by surgical removal of their tumors. Many such patients are now treated with chemotherapy before or after surgery. Chemotherapy can actually shrink tumors to make surgery more successful or destroy or suppress microscopic tumor cells that may be left after surgery. Tumors are much less likely to recur when treated with chemotherapy, and survival is likely to be longer. Despite the fact that adjuvant chemotherapy, that is, chemotherapy given before or after surgery, is associated with improved survival, most patients worry about the side effects. The good news is that several new medications can reduce or even eliminate side effects such as nausea and vomiting, allowing for easier to tolerate therapy.
A lot of people don't realize that chemotherapy is commonly administered on an outpatient basis. Yes, it is strong medicine for a serious disease, but most patients manage well at home. And many of our patients who wish to are able to continue to work at their jobs throughout the course of their treatment.
Most patients with cancer only spend short periods of time in the hospital, such as when they're having a diagnostic workup or an operation or experience a complication of their disease or treatment. People with cancer are almost always treated by a healthcare team. There are many resources, both within the hospital and outside, that are especially geared to helping patients cope with everything from filling out insurance forms to arranging transportation to and from treatment sessions. In addition to the resources available at your hospital or cancer center, your employer may be able to offer help. The decision to tell your boss and coworkers that you have cancer is a highly personal one. It depends upon a great many variables. Are you a private person? How close are you with your coworkers? Is the atmosphere at work flexible and supportive? Although most employers and colleagues are generally supportive, some may harbor misperceptions about the characteristics of cancer as a disease. They may wonder whether it's contagious or whether your productivity will decline.
According to a recently published report, about 25% of all recovered cancer patients experience some type of employment discrimination. That represents about 1.25 million people. One of the myths upon which this type of discrimination is based is that of the unproductive worker. Long-term studies by both the Metropolitan Life Insurance Company and AT&T, however, found no differences in absenteeism, turnover, or work performance between people who have had cancer and other employees. In fact, these and other studies have concluded that it was a sound industrial practice to hire individuals with a history of cancer. Discrimination against individuals with cancer or who have had cancer in the past by employers in the form of reduced health benefits or even demotion or dismissal is now against the law. The Americans with Disabilities Act, which went into effect in late July 1992, provides an additional legal means to fight against this type of discrimination in the workplace. Employers are now required by law to make reasonable accommodations for disabled but otherwise qualified employees. Keep in mind, however, that your employer must be informed and aware of your disability, in this case your cancer, in order to be obligated to accommodate you. All employers should offer help and support during cancer treatment.
You know, could we do anything, maybe have a fax machine sent to your house, you know, so you can work at home?
Well, that would be a wonderful thing, because I would be able to do that much.
If your firm has a human resources office, it can provide a variety of important services. A staff member can help you arrange for sick leave, for example, so that you can schedule diagnostic tests or surgery. If you need chemotherapy, you might need help arranging more flexible work hours.
All cancer patients wonder what treatment will be like. They often ask, will I be sick? Will I be able to do my job as I did before? There are no general answers to these questions. That's because there are hundreds of different types of cancer, each requiring different treatments, which cause different types of reactions. Everyone on your healthcare team will work with you to let you know step by step what to expect during your treatment. There should be no surprises. Our goal as oncology nurses is to teach patients and families to recognize the side effects of their treatment and to report them early. Prompt management of these complications will reduce their interference in your daily activities.
We try to help patients maintain as normal a life as possible. None of us wants patients to think of themselves as invalids or to be treated as such. If part of your treatment plan includes surgery, you obviously will need some time off from your job. But even surgical patients often do not remain in the hospital for long periods anymore. After a brief hospital stay and several restful weeks at home, your doctor may permit you to return to work, depending, of course, on the physical demands of your job.
After surgery, you might need to be temporarily reassigned to lighter duty. And most employers will work with you in the post-operative or treatment period if you need to relocate your workstation near a restroom or elevator.
Coworkers can also be very helpful when you return to work. Your colleagues will be glad to see you back at your job again and can assist you in making your workplace more accessible and comfortable. During treatment for cancer, you're likely to tire more quickly than usual. Depending upon the type of work you do, you may be permitted several brief rest periods.
Even if you have an early stage cancer, one that might have been treated primarily with surgery a few years ago, your doctors may recommend adjuvant chemotherapy to reduce your chances of recurrence. The duration of cancer treatment may be somewhat increased that way, but so is the likelihood of disease-free survival. We all know that your job is important to you and that you may worry about being able to continue working. Fortunately, with today's effective methods of symptom control, it is often realistic to believe that you'll be able to function satisfactorily on the job during your treatment.
To help you maintain your job during therapy, your physician or nurse will try to schedule your treatments in whatever way works best for you. If your chemotherapy treatment is associated with significant nausea and vomiting, you may find it beneficial to be treated in the late afternoon if possible. We tend to keep Thursday and Friday afternoons free for patients whose chemotherapy is associated with more severe side effects. By taking 1 or 2 vacation days per treatment cycle, these patients are usually well enough by Monday to be back on the job.
When it comes to chemotherapy for cancer, physicians and patients don't necessarily worry about the same kinds of issues. Doctors monitor therapy closely for adverse effects such as falling blood counts or damage to heart and kidneys, whereas patients tend to worry about vomiting and hair loss. Some types of chemotherapy cause more nausea than others. Now that we understand the underlying mechanisms of vomiting, we have medicines that in many cases relieve or even prevent nausea.
Your oncology nurse will be with you every step of the way and will explain what you can expect to feel during treatment. You may be given a sedative to help you relax, as well as an anti-nausea medication along with your chemotherapy. Although new patients often think they will be sick during their treatment or on the way home, that's not usually the case. New medications have been developed over the last few years that for many patients virtually eliminate chemotherapy-related nausea and vomiting. Your nurse will give you prescriptions for anti-nausea medication and instructions on how to take the medication should you need it. On the day of treatment, a light dinner of soup and crackers and an early bedtime is usually recommended. Because chemotherapy is most often administered on an outpatient basis, patients are encouraged to report back to us about how they're doing. In this way, we can monitor for side effects and response to chemotherapy. Not all chemotherapy causes hair loss, but with certain drugs, hair loss is inevitable. Losing one's hair is always emotionally devastating. The good news is that it is temporary. Your hair will grow back. Knowing how and when hair loss will occur may help you to adjust to the change in your physical appearance. Your nurse or social worker or the folks in your cancer support group can give you tips about how to lessen the more distressing aspects of hair loss. They might also suggest that you cut your hair short and buy a wig before you lose your hair. They may also show you attractive ways to wear scarves, turbans, and hats.
People today talk much more openly than they used to about cancer. And many people understand that cancer is a serious disease for which there are a variety of effective treatments. Some of your coworkers, however, may need to be reassured that they cannot catch cancer from you and that nobody expects them to do your work in addition to their own. People with cancer are the same as they were before their disease was diagnosed, but they do face some difficult challenges and life changes. They certainly don't need additional stress from job insecurity or hostile colleagues.
A few employers still wrongly believe that a worker with a history of cancer is a liability. If you think that you have been discriminated against by your employer solely because of a cancer history, you now have several legal tools with which to fight back. The Americans with Disabilities Act is a new law that strengthens Title VII of the 1964 Civil Rights Act and the 1973 Rehabilitation Act. Essentially, these laws are meant to prevent employers from discriminating against disabled but qualified workers in hiring, promotion, transfer, wages, salaries, benefits, and termination. The definition of a handicapped person, according to the law, is any person who has 1. A physical or mental impairment which substantially limits one or more of such person's major life activities, 2. Has a history of such impairment, or 3. Is regarded as having such an impairment. It's important to realize that people who have a history of cancer may very well not be disabled anymore, but may be perceived and treated in the workplace as if they are. Unless they can prove undue hardship, employers are required to make reasonable accommodations for handicapped workers, which might include job restructuring, part-time or modified work schedules, and the acquisition of specialized devices or equipment. If you feel you need legal assistance, contact your attorney or the local bar association.
Cancer doesn't just happen to individuals. It affects your family and friends too. Showing them ways that they can help you is useful and will strengthen important relationships. Keep in mind that you are the same person that you were before the diagnosis.
Cancer is a serious illness that many patients now survive. If you want to keep working, a great many people are ready to help you.
Employers value good employees. You're likely to be surprised at the level of support you'll receive at work. However, if you believe you have been discriminated against because of your cancer, the law is now firmly on your side.
For most adults under retirement age, work is a major part of life. So take advantage of the support offered by your healthcare team, your employer, and of course your family and friends. Together with all the people who care about you, you can learn how to cope with and work with cancer treatment in your everyday life.